Good morning. Welcome to our weekly media briefing for COVID-19. I'm Carrie Schutte. I'm the Public Information Officer for the COVID-19 response team. With us today, we have Robin Schurig. She's the Director of the Public Health Branch for the Health and Human Services Agency. Dr. Karen Ramstrom is our Health Officer. Donnell Ewart is the Director of the Health and Human Services Agency. And Matt Pontus is the CEO for Shasta County. Also joining us today, we have Jake Mangus, who is the President and CEO of the Reading Chamber of Commerce, and he's going to talk to us a little bit about businesses and some things that might be available to businesses and their employees who may be affected by COVID. This morning, we're going to start with Robin Schurig. She has a few things to share, and then we'll move to Karen and then to Jake.
Thank you. Good morning. So I just wanted to point folks to some guidance that has been available on our website for a while. It's on the shastaready.org page under the Roadmap to Recovery section, and it is about Halloween, which is coming up in just a few days here. So we just want to make sure that people understand some ways that they can make their normal Halloween activities a little bit safer in this time of COVID. Just like everything else, we can't do things the way that we normally would, but there are some pretty simple measures that you can take to make it safer in this time of COVID. So basically, if you remember the main principles of stay home when you're sick, distancing and masking, you can apply those to things like trick-or-treating and make them a little bit safer. So if you are sick or if you have been around someone who has COVID or may have COVID, don't go trick-or-treating and don't hand out candy to trick-or-treaters. But if you do participate in trick-or-treating, make sure that you go only with your household members. Make sure that you leave 6 feet of distancing between yourself and other trick-or-treaters, as well as the people answering the door. So if you can go up to a door and ring the doorbell, set your bag or bucket down and then step back, then the people at the door can put candy in your bag for you. And then you can, go up and get it backed away. Also, masks is another thing that is important to remember. And it's a little bit tricky with Halloween costumes. A lot of costumes come with masks, and a lot of times they either have openings for the nose or mouth, so they're not really protecting others from your respiratory droplets the way that a cloth face covering will. And also they're oftentimes made of materials that don't really absorb those droplets. So like a hard plastic mask or a rubber mask is not going to do the trick. So you can either wear a cloth face covering in place of those masks or underneath those masks to make it a little bit safer. And those are the main points. There's lots of other information on our guidance that you can check out on our website. And I will turn it over to Karen.
Good morning, everybody. So today I wanted to talk about two topics, prevention and testing. And I want to talk about these because we really need the community's assistance to keep us out of the purple tier, at least keep us in the red, if not hopefully help us to move back to the orange where we have were able to stay for a bit in the new tier framework. These are some concepts we've talked about, but not for a while. I just want to provide a reminder about these two fundamental strategies, prevention and testing. And these are going to help the pandemic in a manner that will protect both the health of our community members as well as our community's economic vitality. So prevention, we've been talking a lot about immunity, but really we should be talking about prevention. We should be talking about preventing new infections. The way to slow and ultimately stop the spread of this virus is to prevent these new infections. And we know how to do that. We talk about it all the time. Our businesses and schools and our faith community are doing their part with modifications to create safe environments for us to go and enjoy our favorite restaurant and personal services and to keep our kids in the classroom. So I think a piece that is missing is what do we all need to do as individuals in order to continue enjoying these daily outings that we enjoy so much, our part and to help and ask ourselves, particularly when it comes to social gatherings, whether that social gathering is worth the risk of increasing community spread and sacrificing our businesses and children's education. And likely the answer will be no. If the answer is yes, that's something that we need to start talking about. And as we're thinking ahead, moving into the holiday season, we will begin sharing some suggestions with our community so you can actually make those choices. But we asked you to really take that question seriously and weigh the pros and cons. Second, in terms of testing, We talked a little bit previously about testing what we call our essential workforce. I want to talk a little bit about why we recommend that and what the benefits are. The idea is to routinely test individuals who have regular interaction with coworkers and with the public. You might, and generally we recommend individuals in these groups to go get tested out at the state testing site out at Shasta College. Even if we're careful with our physical distancing and mask use, infection can still occur, particularly in our personal lives where we might let our guard down, in our households where there could have been exposures. The goal of this regular testing of essential workers is to identify infections that might be mild or have no symptoms. And so an individual won't even know that they have contracted the infection and can potentially spread it in their workplace and to their families. So an extra bonus too, related to the tiers to keep us out of the purple, is that the more workforce that we have testing regularly, it increases our testing volume and we get credit that adjusts down our case rate. So that's an incentive built into the framework, the state framework. We will pick up some positives, and yes, we hear that argument frequently, but the higher volume of testing offsets that increase in our case rate. And so we really just want to encourage the community to be thoughtful about what you're doing, because it does impact our tier and it does impact the services that we can enjoy in our community. So now I'll pass it on to Jake.
Unmute myself there. Thank you, Karen. Appreciate the opportunity to be here today, to have the invitation and all of that. I would say the biggest thing from the chamber standpoint has been the County CARES Act grant program. And I've been invited to give an update to the Board of Supervisors next Tuesday, so I will do that. I'm going to be meeting with the program manager later this week and doing some data mining so we can come up with some great stories to tell from the numbers themselves, but also we have some actual stories that have come in the form of gratitude from 250 emails that we've received in response from businesses across the county. So grateful for the funds that have been dedicated to help businesses at this time. So I'm excited about that. We will be able to distribute the full contract cap amount, which was $3 million, and that's exciting. We did not have a waiting list as of last week, but this week we do. So we have a manageable waiting list, I would say. We're also going to be working with any of the businesses on the waiting list that may qualify for our CDBG grant programs, which are running in the cities of Reading, Anderson, and Shasta Lake at this time, and shifting them over there. I'm also working with the city of Reading right now in making a couple of edits to that CDBG grant program that will allow for more businesses to qualify. So we're doing our best to get all of the funds that we have available to us out into the business community right now. And we are so grateful for the work of the Board of Supervisors and County Administration, Matt Pontus in particular, also Karen Ramstrom and Donnell Ewert for everything that you all have done in working with the state on a statewide level to convince them to see it our way and to remain in the red tier. That was one of the bigger victories that I can remember in this whole COVID saga for the business community. So we've got restaurants that are open and offering indoor dining. For the foreseeable future, we're going to be doing our best to communicate a message that I'm borrowing from our friends at the Las Vegas Chamber of Commerce, which is stay safe, stay open. We want to keep the numbers dropping so that we can keep our business community open and thriving at this time as best as they can under the circumstances. We do have information on our website at readingchamber.com under our Rapid Recovery Program link that has links to a lot of other resources for employers and some for employees as well. So we always encourage people to check that out. And we continue to do our best to communicate and collaborate with all of the partners, public and private, in the community to bring those resources to the businesses, as it is a changing situation, evolving and fluid and all of those things that we've heard.
Right. Thank you, Jake, for all your work. We appreciate it. Does anyone else have anything to share before we go to media questions? All right, I think we are ready for your questions.
Well, good morning. I had a question for someone on the county side of things. As far as we're seeing some spots in the country now where hospitals have been overwhelmed or get close to capacity by cases of COVID. I know we've been low here, although we had the highest ever the other day with 14 hospitalizations. How big of a concern is it? How prepared are we in case there is a big surge, and how likely is that, I guess?
Sure, I can address that. It is concerning, and this is what we talked about a couple of weeks ago, and it's been seen nationwide when a community has an increase in cases. Oftentimes, that's among younger adults because they have not typically been as compliant as older populations with the prevention measures. And when that happens, it can be followed by an uptick in older adult populations, which can result in hospitalizations. And so that's what we're seeing right now. Our hospitals have done a lot of preparation. They are managing, but it's difficult. And they are having to have longer hours for staff shifts, those kinds of things. I think their planning is paying off right now, but it's not where we want to be. We don't want those individuals. We don't want people to end up getting infected, individuals who are at higher risk and end up in the hospital. And so it's concerning, but our hospitals are managing, but they have plans for implementing that if need be. We're not close to that yet, and we would do everything that we could to try and continue patient care in the hospital setting. But we're ready to do that if we need to.
Sure. Thank you, Doctor.
Mike, the equipment that we were originally given for the field hospital was sent to another community, so we do not have that equipment on hand, but we have other equipment that's in our cache for alternative care site, and we have a place to do it, so we are prepared. But the federal medical station has gone elsewhere. I did want to mention also that the incidence around the country is dramatically different in different regions, and that's part of what leads to the hospitalization issue. And sometimes other states get mentioned in some of our board meetings as places that we should be copying, and North South Dakota are often mentioned. And I just wanted to say that those are the two states with the highest case rate in the country right now. So I don't think the strategies they're using are probably in the best interest of our population. Their new case rate per million is over 1,000 in both of those states, and it's 81 in California. And our case rate right now is 7.5 per 100,000. In the last report from the state, our case rate for Shasta County, that's per 100,000, so that's 75 per million. So you can see, the rates in some of these other places that are not taking community mitigation strategies seriously are dramatically different. Wisconsin is another hot spot. They're at 945 per million. And there's a lot of other states that are in the 300s and 400s. So the community mitigation strategies are important. Containment is our job, and we take it very seriously and work very hard at it, but we also need the community to participate in limiting transmission through their own behavior. And that's what Karen was addressing in her first comment, is everyone's got to participate. No one institution or sector of the community can solve our problem. We've all got to work together, and by doing so, we help our schools and we help our businesses.
Thank you, Donnell. You mentioned case rates. Is there a number that we watch for here, or is it all dependent on the number of tests? As far as, there were 30 cases today, that's good, that's bad, whatever. Is there a number that we need to be concerned about to keep us in the red, if not going to the orange, rather than bumping back up to purple?
States' ways are a bit mysterious to us as far as how they make calculations. So that's a difficult question to answer, unfortunately. I don't know if Karen or Robin wants to comment as well.
Yeah, so the way that the state calculates our case rate is based on what they call episode date. So for each individual case, they assign it a date, and it's either when the person's symptoms started or when they got tested, whichever is earlier. And so when we're looking at how many new cases we receive each day, we can't necessarily just translate that into a case rate because we have to investigate those cases and find out that information as far as what date they're going to fall on. So it is a little bit difficult to tell just from our daily reports how we're doing compared to the tier system. But we are internally monitoring that data, and the state is monitoring it as well on an ongoing basis. So we would have a little bit of a heads up if we felt like we were headed back to the purple.
Is there, I'm only thinking like for a community, campaign in a way, as far as let's keep our cases under 30 or 20 or whatever, is there any kind of a number that we can shoot for? I think it's for my own personal security, I guess, too. It's like when I see the number, like, should I be worried or should I not be worried?
Smaller the better. That's what I would say about the numbers.
All right, thank you.
I think our goal is to try to get to yellow, and in order to get to yellow, we only can have a handful of cases every day, and so we really have a long way to go. We should all be concerned with the numbers we're having right now. It does put us at risk for being in the highest or the most restrictive tier. So we need to all do our part. We should be having less than 5 cases a day if we have any chance of getting into the less restrictive tiers.
Thank you, Donnell. Good to know. All right, so that's our goal then. Thank you.
Other media questions?
Hello. I had a question about the reports that come out daily. Is there any way that they could come out earlier than they are coming out now, which is like 4:30, somewhere in there?
We've had a couple days this week this week feels like it's been already 8 days long, but we do try to have those out by about 3 o'clock. In some situations, it takes a little bit longer to get the numbers distilled the way that we need them to look before they go out, or we're confirming certain things. But yes, point noted, we will do our best to get those out by 3 or 3:30 at the latest.
Yeah, great, thanks. Yeah, I realize that there's lots of number crunching that needs to go on. So, but just whatever, just to bring that up, and thank you very much.
Any other questions? Hearing none. Thank you again, Jake, for being our special guest. Come back anytime. And we will see you all again next week at 11 a.m. on Wednesday. Everyone stay safe and healthy.